So I asked those questions again. Ben gave some great information about collaborations. We even talked about the definition of collaboration. Co, of course, meaning together, and then labor meaning work, the whole piece around working together. But I would like to challenge you that even beyond that, you have to be flexible. So when I got up here today, I didn't plan this. But again, I'm one of those people that I thrive off of energy. So you have to be flexible, and you have to be willing to have fun, because as we're going to work together, all work and no fun, at the end of the day, when you have those hard days and when it's a lot of work, you need to at least be able to say, hey, but I'm having fun. I have a passion for what it is that I am doing. And then again, last but not least, energy. Being able to bring energy, positive energy at that, into a room when you're working together with different organizations. And so I hope that at least got some blood circulating a little more. And as Reginald mentioned, my name is Lavette Sattler, and I work for the North Carolina Community Development Initiative in Raleigh. Just by the show of hands, how many of you are familiar with the initiative? I know a couple of people in here. Okay. So the initiative actually was started in 1994, and our primary mission really is to build leadership, as well as we provide capital investment to high-performing community development corporations and other partner groups across the state. And so we do this primarily through 5 different areas. One being grant making, lending, technical assistance, advocacy. We do some advocacy work, as well as development. But today I would like to talk with you about our new innovations program. So we received a grant from the North Carolina Rural Center, and this grant, through our partnership with the association here, which I say North Carolina's association, and I just want to thank you, Sharon, for giving us the opportunity to be a part of this panel discussion today. But through that partnership, we are bringing together CAP agencies and CDCs, and looking at how they can collaborate, how they can best work together to serve the families that they're already serving, serve the communities that they're already working in. And so we really want to create this national model of how best the 2 different types of groups can work together. And so that's what we'd like to share with you today. Again, Barbara Blackston and Reginald, they are 2 of our partner organizations. Barbara, of course, is a community development corporation, and then Reginald's group being that CAP agency. But really want to just discuss different ways we can collaborate, the different opportunities that are out there. So I hope that you find the information that we share with you informative, and I will turn it over to Barbara.
Oh, it's on me now. Okay.
Yeah.
Well, good morning, everyone.
Good morning.
As Lavette mentioned, I am Barbara Blackston, the Executive Director of Wilson Community Improvement Association. And it's a position that I've held since my mother, Mrs. Fannie Corbett, a founding member, retired in June of 2000. Prior to becoming a staff person, I was a willing volunteer as an adult, but later as a young, I said it backwards. Becoming a staff person, I was a willing volunteer in my later years, and not so willing as a youngster. I went away screaming and hollering often to meetings. I have an extensive background in retail, banking, commercial, and residential real estate. WCIA was founded in 1968 by a small group of neighborhood residents and community organizers that were funded by the Foundation for Community Development, or FCD. Initially, they started organizing residents to address such issues as unpaved streets, improved city services, housing code enforcement, and voter education. But let me just back up a little bit and tell you a little bit about CDCs and how we actually got started. The history of CDCs actually started actually goes back about 50 years. The CDCs in North Carolina date back to the late 60s and early 70s, which kind of parallels with the CDC nationally. As a general rule, we operate in urban and rural areas to targeting services to low and moderate income families. In 1963, Z. Smith Reynolds, Mary Reynolds Babcock, and the Ford Foundation provided money to establish the North Carolina Fund. And the purpose of that fund was to break the cycle of poverty that was plaguing so many North Carolina residents. Somewhere around 1967, there was a little tension regarding the funding distribution. At that time, as many of you probably already know, the fund was financing 11 community action agencies within the state. So the director at that time wanted to extend the financing to some organizations that was controlled by African Americans and consequently formed the Foundation for Community Development, or the FCD organization. And it was at that point that the foundation started providing funds to low-income groups and actually focused on issues such as infrastructure, housing, economic development, and the distribution of wealth. Among the earlier groups was my organization, Wilson Community Improvement Association, and the United Durham Incorporated, which is UDI today. It was also in the early 80s that Legal Services of North Carolina devoted funds to community economic development, advocacy, and training. Their mission at that time was to revitalize and to help build capacity of the local organizations to do the work, because a lot of us were actually very low on staff as well as funding. This actually led to Legal Services filing the state first challenge under the Federal Community Reinvestment Act, or the CRA, of 1976. A year later, CRA agreements were signed by many banks, and many of them funded and implemented community needs assessments in response to the CRA. During that same year, Z. Smith Reynolds, Mary Reynolds Babcock also funded a capacity building project to help communities establish CDCs. So at this time, funding was actually beginning to start coming in. By 1988, it was clear that the CDC's industry was going to be revitalized, and it was actually going to be a force to be reckoned with in the economic development activity of our state. It was also during that time that the North Carolina House of Representatives, at the urging of the Legislative Black Caucus, enacted a bill that would appropriate funds for minority economic development projects. This bill did not pass, but a similar bill passed that appropriated funds to several organizations, including the North Carolina Community Development Initiative, for CDCs to demonstrate how they could improve the lives of residents of undeveloped minority communities through business, commercial, revitalization, and housing development activities. It was in 1989 that we actually received our first funding, and we started to evolve from a neighborhood organization into an actual community development corporation.